How can a known poison that exists in our food supply, our medications, and sometimes even in the air we breathe, be totally overlooked as the cause of disease in America? Watch us daily and soon you too will know the cause. Welcome to another edition of a show that you will love. It's called Know the Cause. I'm a little dressed up today because sitting right over there is America's most trusted pharmacist, Suzy Cohen, and then Dr. Greg Emerson, all the way from Brisbane, Australia. I get to interview both of them in just 30 seconds. So that's very, very exciting for me. We're going to talk about all sorts of health issues. The year was 1987. A real nice guy by the name of David Weekley, he's a board-certified dermatologist, calls me in Los Angeles and questions the validity of a statement I made in a book. In the book, I said, I think skin problems are this deep, and by changing your diet, it will change the pattern of the skin problem, maybe even cause it to go away. Well, David took exception to that, flew to Los Angeles and saw me. After about 9 months of talking and seeing patients with psoriasis who had gotten better in eczema and skin conditions, lo and behold, he made me an offer to come to Dallas, and here I sit 23 years later. Sitting with me are two real authorities on foods and supplements and good health. We're going to talk about skin problems right now with Suzy Cohen, America's most trusted pharmacist and an author of many books, but Diabetes Without Drugs gets an A every time. Dr. Greg Emerson is all the way from Brisbane, Australia to join us today. Putting you two together is enough fun for me. I mean, you're both such like-minded people, but here we have a chemist, pharmacist, and a physician. Let's talk, Suzy, a little bit about skin problems being gut deep. Are they really?
Oh, absolutely. There are well-designed clinical trials that prove that gluten, the wheat protein, and casein, the protein in dairy, can cause a reaction on the skin in people who are sensitive. And this can be the very cure, eliminating those things, for people who suffer with these conditions like psoriasis and eczema and skin rashes and even other things like asthma, neurological symptoms. This is well known. It's not that these foods are bad, it's just that in some people their immune system kind of goes crazy and they don't know how to process it, and they're just so sensitive, and then what you see on the external is what's going on internally. I
have been into pharmacies to pick up Band-Aids and things like that. Thank God I haven't needed the drugs, but I see Ask the Pharmacist. And I can just see you, Suzy, handing out the methotrexate to a little girl with allergy or with a skin problem and whispering, get off the wheat, get off the milk. You know, I mean, were you allowed to do that? Could a pharmacist do that?
Of course.
And you won't need the methotrexate. You
yeah.
know? So, okay, Dr. Emerson, you've seen the same thing a world away from here, is when people change their diet, the asthma, thank you for bringing that up also, allergy, asthma, skin texture, hair, etc., all begins to change. Have you found major offending food groups that might fit for people watching the show?
Oh, absolutely. There are three, when you talk about skin, there are three key things to think about. One is, as Suzy talked about, is the health of the gut, because no doubt the skin is just a reflection of your internal terrain. So fix the gut, get rid of the yeast, get rid of the parasites, get rid of the heavy metals disrupting the gut. Second thing is take away the foods which are causing food sensitivities and food allergies. And as Suzy mentioned, wheat and dairy and yeast would be the three top ones. And then the third thing is looking at minerals which are crucial for the health of the skin, and foods which are crucial for the health of the skin. Aloe vera, fantastic for the skin. And things like the skin of the cucumber, which is really high in silica, and garlic, which is high in sulfur, because the minerals really crucial for skin health are silica and sulfur. So if you're having a vegetable juice every day, I always tell people to leave the skin on the cucumber, because you get a big dose of silica, which is great for the skin, makes a huge difference.
Is Australia different than the US? Are there more doctors over there who get this, who understand by changing a patient's diet you'll impact their health, or are we both lost?
No, I think that there is a paradigm shift changing, that people are slowly starting to realize that diet now does have a big role in your health.
Suzy, acne and methotrexate just seem to go hand in hand for so many years, and now all of a sudden we're coming to our senses, I believe, and we're questioning this. If you suffered from acne, cystic acne, what would you do? Would you look at your diet? Would you look at your lifestyle?
I would look at everything. I think something like cystic acne, you might want to look at estrogen hormones, because sometimes that's just a sign of estrogen dominance, and bringing that down, bringing the estrogen level down and the progesterone back up and getting those hormones in balance could be very valuable. Zinc in a teenager may be a little different. I would suspect zinc deficiency there, or maybe too many sodas and junk food. But a simple trick that your viewers may want to do is if they're living on bottles of hydrocortisone cream and just buying this for their skin condition to soothe the redness and the itch and the allergies. I want them to consider something like coconut oil instead.
Yeah.
Just get it at the health food store. Try that. You can even mix it with a little hydrocortisone in your hand and apply it to an area of your skin and watch the magic happen, because coconut oil is such a powerful antifungal and skin soother.
You know why I like interviewing both of you together? While Suzy's talking, Greg is going, and while Greg's talking, Suzy's going, 2 thumbs up. Thank you both for really honoring the viewers of Know the Cause and coming and sharing all of this with us. Don't go away, my friends. I'm going to be right back with more of Know the Cause. We were just talking before we went on the air today that this is a rare day in Rockwall, Texas. We have 2 of the world's leading authorities on nutrition and health. Joining us is Dr. Greg Emerson, all the way from Brisbane, Australia, and Suzy Cohen, America's most trusted pharmacist, author of a bunch of books, but the most recent one, Diabetes Without Drugs, is doing very well, I understand.
Yes, it is.
You know, one of the reasons I wanted to get you 2 together was to talk to me a little bit about the epiphany. When did the light bulb go on? Greg, you graduated from a big medical school, 8 years of that. Suzy, you're a chemist, a pharmacist, etc., 8 years of schooling. And then one day something happened. You either saw a patient or saw a mom get better by changing her diet, but something introduced you to nutrition. Suzy, I'm going to start with you. When did that light go on?
Wow, that's a great question, because I've been a pharmacist for 22 years. So that's counting a lot of pills. But I think it was just a combination of a few things. For one thing, I noticed that after I dispensed medication, sometimes the patients would call the pharmacy because they were experiencing a side effect, which in some cases was worse than what they were trying to treat to begin with. So this was very disconcerting, because, you know, I really care about people, and my pills were making them sick. So it made me think, you know, what's going on here? And that was compounded with the fact that my husband had been dealing with some symptoms that were not really easily diagnosable, and he was bouncing around from doctor to doctor. Come to find out that it was just gluten, the wheat protein, and he was allergic to gluten. And when we took him off of that, a lot of things cleared up. It was just amazing, and I learned that food can act like a drug, and it can have some problems in the body too.
You know, the father of medicine, Hippocrates, once said, let food be your medicine and medicine become your food. How long ago was that? How long ago did the light bulb go on? You say 22 years? What were you, 5 years old when you graduated? Okay, so at some time within that 22 years, a light bulb went on, and you said, gosh, when I tell people to change their diet, they seem to have their arthritis clear up. How long ago was that?
Probably about 13 years ago.
Ooh, so 9 years into this business, all of a sudden you thought, okay, there's something to this. Dr. Emerson, same with you. Now, you're a world away from us. You're in Brisbane, Australia. But the same thing occurred to you, right? You're an emergency room doc. You and I have talked about this, and you told me that you saw patients too late, right? They're coming in at 30 years old with a heart attack, and so you really wanted to impact change upon them. When did that light bulb go on for you?
Well, from a food perspective, when I first realised that food could be a medicine, was a personal experience. Initially, was I had developed quite bad arthritis in my knees. I could no longer run. I used to do a lot of running, couldn't run anymore. Realised through another reason that I was allergic to dairy and soy. Came off the dairy and soy, and my arthritis went away. I had put my arthritis down to my professional basketball career, but it came off dairy and soy, and the pain went away, and I've been able to run fine ever since. And then when my daughter was 9, one of the other, her best friend in her class at school had intractable seizures, was on 2 anticonvulsant medications. Her bone marrow was failing. They were trying to put her onto a 3rd anticonvulsant medication, and all we did was took her off the food she was reacting, one of which was gluten, and she hasn't had a seizure ever since, and is now on no anticonvulsant medication. So went from being on 3 anticonvulsant medications at the age of 9 with bone marrow failure to having no anticonvulsant medication and no seizures. And her sister, who had asthma, did the same thing, and her asthma went away as well. So very early lesson that food was powerful.